Good morning, everyone. I am Janice Shupp, and I'm Chief Strategy Officer for Health Foundation of South Florida. I also have the privilege of being a board member, Vice Chair for Miami Homes for All. I want to welcome you all to today's summit. It is a very exciting time for both organizations. As David said, I think one of the things that we want to make sure you come out of today is with new partnerships, new relationships, new ideas on how we can be more intentional about working together across sectors, in particular the community economic development sector and healthcare, to improve the health and well-being of our South Florida community. And I have the pleasure today of moderating this first morning's panel with colleagues of mine and people that I respect and admire for the work that they lead within their own respective organizations and beyond. Annie Lord, Executive Director of Miami Homes for All. She brings 20 plus years of experience in community development and is a native of Miami. And I have to say, under her leadership, Miami Homes for All has really been transformed and positioned to be a go-to organization when it comes to affordable housing policy and solutions. To the right, Barbara Fonte, who's the Vice President of Managed Care and Population Health at Jackson Health Systems. Jackson Health Systems is the largest safety net provider in the Southeast region. So Barbara will be sharing her expertise today and really helping us understand the intersect between health and housing, and why is it so important that housing stability, affordability is critical to improving not just individuals but communities' health and outcomes, and how all of that impacts healthcare costs. So thank you, Barbara, for joining. And we also have Sandra Dennis. Sandra is the Executive Director of Miami Workers Center, which is a community empowerment, power-building, member-led organization that works with residents, women, care workers, tenants, and really supporting them to become advocates for their rights and resources that they need to lead better lives. She is a community organizer, an anti-classism, anti-racist community organizer, and she is really paving the way for leadership across Black and immigrant working class residents so that they can take ownership, as David said, of solving for these issues in their communities. So thank you all for joining. So for me, personally, the most exciting part about this panel is that you can see they're each bringing their own perspectives. It is very rare to see health, housing, community organizing all in one space. And so I want to start with Annie. Miami Homes for All has recently commissioned a report on the current state of housing. Could you please give us an overview of how dire is the situation here in our community?
Sure, and with apologies to David for having commissioned yet another report. Although it had been a few years, so we just did a very quick update, and I want to say thank you to the University of Florida and Ann Ray at the Schimberg Center for Housing Studies for partnering with us once again on that. And I want to talk about two things super briefly. First, the state of housing in Miami-Dade, but also the state of housing policy. And at the risk of kind of shocking us, into extra awakeness, this is the direness of our shortage. I want to just point you to these three bars. The shortage of rental housing in Miami-Dade County it's more than this, but I really just wanted you all to focus here. For those earning between 0 to 50% of the area median income, call it about $45,000 a year per household, we have a shortage of over 135,000 rental units just in Miami-Dade. It starts to come down as you go up the income spectrum. Up to 80% of the median income, $75,000 a year or so, We have a shortage of over 90,000. And this is a really important next bar, because once you start to go up to 120% of the median income, right, $90,000, $100,000 per household, that shortage is not nothing, but it plummets. So as we think about what story are we telling in our community about the need for affordable housing, let's make no mistake about where that need lies. And I want to, just very briefly, one more piece of data that's important is that over a third of our households are earning less than $35,000 a year. And that's going to remain. When we look at, this is kind of a lot, but let me just break this down really simply. Of the 37 or so thousand jobs that are going to get created in the next decade, 70% of them are going to pay less than $20 an hour. So what does that mean? As a native Miamian, right, who are we? And who are we going to be for a decade? Right? I think we've all seen the reports, recent reports, about who is moving into Miami. And we've seen it in our neighborhoods. Who's moving here and who is leaving here? People moving here earn more than the median income. People leaving here earn less than the median income, typically. And the people are moving here because they can. And the people who are leaving here because they must. So when I think about, sometimes I ask people, what is the risk? Like I'm, engage in conversation, and even, people, I recently spoke with a CEO of a very large development firm, and I said, what do you think is the risk of our housing crisis today? By the way, right, in case anyone didn't know, we're the least affordable city in the country. And she says, well, we become the next San Francisco. In terms of the street homelessness crisis that San Francisco, LA, New York, Seattle are all experiencing, that we don't have right now, right? We have pressure. But I actually think, and I spoke to someone from the Beacon Council recently about this, I actually think the negative repercussions of this look different, because our economy is so driven by low-wage work, right? It's a service economy. It's a lifestyle economy. We can embrace that. That's not going to change. It is our competitive advantage. Sure, we also want higher paying jobs. We also want tech to come here. That stuff's happening fantastic. That's going to enrich our community. But let's not forget that one of the things that makes us distinctive from the rest of the state and the rest of the country is that we are a place driven by the service economy. So what happens if we don't have workers who can be here to make this event happen? If we don't have workers who are in our hospitals, medical assistants, cooks, if our logistics don't function, then our economy really starts to grind to a halt. So not only do we have a humanitarian crisis, which, I know that Sandra's going to talk about, like, what does it look like in the community today? But also, our economic drivers are going to slow down. So sometimes I'm called the grim reaper of affordability, so let me just transition really fast. The second thing I wanted to talk about, that's the state of housing today. I want to talk very quickly about the state of housing policy today, which is why I am optimistic, even given all of this. Housing policy is moving forward, right? Not everything is perfect, but new state housing policy is making big waves already to increase production of housing. New sources of revenue and sources of funding that are going to the capital stack for housing, these things are increasing. What I think needs to change, what really needs to adjust as we continue to focus as a community and as policymakers, we need to make sure that the resources and the incentives are going, back to this slide, are going to the right place. And what we observe is that the narrative and the resources, incentives are shifting more towards higher income households. Nothing against higher income households. Let's just remember where the need is. And I think as long as we continue, I think right now more than half of the incentives and the resources that are being created in the last couple of years are going more to this 120% of the median income. That's upside down. So as we think going forward what we're going to do, let's make sure we don't miss this. Thanks.
And clicker. Thank you so much, Annie. So, Barbara, one of the things that the Health Foundation often gets is when we go into a meeting, a roundtable, where the discussion is housing or any other of the social drivers of health, they're like, why is the Health Foundation here? Why are they leading this work or this effort that's focused on improving the economic well-being of residents? And so, can you speak to us a bit about, why is healthcare now having this conversation around issues like affordable housing, and what's driving that for you all?
Thank you so much, Janice, and I couldn't have asked for a better table set between that introduction and David's comments earlier. For a very long time, 6 years, this has been a dream, this type of conversation. We at the Public Health Trust are on the receiving end, right? We are here to serve everyone in our community, regardless of their ability to pay, and we are responsible for their care in whatever state they arrive at the threshold of the Jackson Health System doors. If we think about how our conditions arrive, the health systems are only responsible for 20% of your health outcomes. The other 80% occur outside of the footprint of the Jackson Health System. So oftentimes we're very aligned in what we're trying to achieve, and I think David couldn't have pointed it out any better. I have this analogy that we're all on kayaks trying to get, to the island of Utopia, and we're all on different kayaks. If we could just hop on the same kayak, we could get there a lot sooner and a lot quicker. So hopefully, after I kind of go through our slides today, they'll never ask the question of why the Public Health Trust or the Health Foundation are sitting at the table on housing. So Janice asked me to share a couple of trends in healthcare. There are three major trends that are driving health today. One, healthcare administrators like myself, veteran administrators, we wake up to do three things every day: to improve health outcomes for the communities that we serve, to address the scaling cost. So we wake up trying to reduce that cost. And of course, to provide a good service to the communities that we serve. Those trends are being impacted by advances in data and analytics, and it's no longer about the clinical analytics, your blood work and your diagnostics. We're starting to look at spatial data. We want to understand what zip codes are generating the catastrophic illness, and we're hoping to get into those zip codes. I'll get into that in just a minute. And it wasn't until 2020 that the federal government acknowledged the social drivers of health as an influential component of our health outcomes. And I think that was precipitated a little bit by, it's a silver lining from the pandemic. So when we're asked, why are you in the room? How can we affect the pillars of health, mental, spiritual, emotional, physical change and improvement without housing? At the center of respite, of physical and emotional improvement, you have to have shelter. Without it, our work is for naught, and we will continue to be receiving catastrophically ill patients at our thresholds. So let me share with you a little bit about the financial impact. This is just 1 year of statistics at the Jackson Health System. Last year we saw over 8,000 unique homeless individuals come through the health system with multiple encounters. So thousands and thousands of encounters for each of those, for that population. The average cost for caring for our homeless individuals is over $10,000. In the post-pandemic reality, our costs scaled 25%, and we still haven't fully adjusted from that. So as you can imagine, this is growing by the moment, and this is why we were in the room having these conversations. So I'm often asked, what can we do? I shared the analogy of hopping on the same kayak. Having these conversations, I'm so appreciative to the Health Foundation and to Miami Homes for All for convening us. We want to continue to bring multi-stakeholder groups to the table. I think David also mentioned in his conversation, I couldn't relate more to the slide that he had up. We can no longer afford to allow the tail to wag the dog. And in this case, to answer David's comment, the Public Health Trust here in Miami-Dade County is that core element. And we are trying to share our story because we are publicly funded with your taxpayer dollars, and we have limited funding. So we are at risk financially for the care not only of the homeless individuals, but of the 60,000 unique uninsured lives that come through the health system, and every resident of Miami-Dade County. We currently have 500,000 uninsured lives in Miami-Dade County. So there isn't an endless pot of taxpayer dollars, and we have a fiduciary responsibility to get out into the communities and understand what's at the core, what is driving and that scaling cost, and looking at the problem differently, as David mentioned. So 2 final things I want to share with you that are driving the case for change and for these discussions. I'll start with the graphic on the right. I shared with you earlier that only 20% of health outcomes are affected on the footprint of a health system. The other 80% have everything to do with the socioeconomic factors that affect and influence our lives, where we live, where we work, the physical environment, our climate, our shelter, and our health behaviors, the lifestyle, our substance abuse issues, and the like. So if we can only influence 20% of health outcomes, we have a responsibility to influence the other 80%, because there aren't endless funds and there is scaling need. On this other graphic, it's one slide out of the recently conducted Community Health Needs Assessment here in Miami-Dade County. The first purple quadrant up on the left-hand side is access to care. So for a healthcare administrator, this is acceptable. We understand that access to care would be a community health need. It's not a surprise. The other 3 quadrants have absolutely nothing to do with healthcare. Absolutely nothing. So preventative medical care is no longer just about medicine or receiving your annual visit. It's about the zip codes that we're born into. It's about the community surrounding. It's about the services that are available to the members of that community. And this is at the very core of why we're on this stage today having this discussion. Thank you, Janice.
Thank you, Barbara. So, we've had the opportunity to hear about what's the current state of housing, current state of health, and kind of what's bubbling up in terms of driving health disparities and health outcomes in our community. Sandra, could you speak from, from your perspective, like how is this being felt in the community, right? On the ground, what are you seeing as top issues? And then how is Miami Worker Center kind of helping residents, tackle, address these big issues that they're facing.
Absolutely. Thank you so much for having me. And I want to thank the previous the moderator, my panelists, who really teed me up. I want to just think about one of my staff members who says, we're going to wake it up today. And so we live in South Florida, and we benefit for so many of the great things that exist here. But South Florida is also known for being flashy, for being the dance party of the nation, right? But we actually don't want to talk about the realities that people are experiencing in South Florida, in Miami specifically. And it's something that we need to get comfortable with, right? It's something that makes us uneasy. And so I'm just here to wake it up today about what folks are experiencing. At Miami Worker Center, if you know us, some of my members are here. We're talking about Miamians, folks who have lived here, families who helped to build this city, folks who are from Bahamas, who people came so that Miami can become an official city, folks from the Caribbean, Latino folks also make up our base. And so we're super proud to be here and to really talk about what Miamians are experiencing. Really quick, so you all know who we are. We actually are unapologetic about naming housing is a human right. We don't believe it's a luxury for the wealthy. We believe it's for everyone. We believe that if we want a healthy community that everyone deserves, no matter where they come from, what they look like, how much money they have, that they deserve a place to live. Does anyone believe that here in this room too? That's right. And so Annie alluded to this. The secretary of HUD came to Miami, and she said that we led the nation in the housing crisis. And we also believe that because we lead the nation in the housing crisis, that the boldest and the biggest solutions also have to come from Miami. And so we're gonna talk about what that looks like, and we're gonna ask people, similar to what the keynote talked about this morning, is that the ideas, the solutions have been coming from the people who are actually experiencing some of these housing conditions as well. Since 2020, if you remember 2020, pandemic year, there have been 77,000 evictions filed in Miami-Dade County. And if you know evictions, you know that evictions have a multiplier effect. And so when you see 77,000, you could times that by 3, how many people could live in the household. And if your family is from the Caribbean or you're an immigrant, you might can times that by 7, because we have multi-generational households. And so this is a bigger number than we all think it is. And we know evictions are violent and they're harmful and they have detrimental health impacts on our communities. We're going to talk about that as well. Families with children are 3 times more likely to also experience evictions. And so often people think about single adults, but when you think about evictions and where you picture evictions, we want people to get comfortable with knowing that children are in the shelters, children are on the streets, and we need to ask ourselves that in Miami-Dade County, is it okay for children to be in the streets? And if it's not okay, what are we gonna do about it? Are we gonna get bold, and are we gonna get our best solutions to ensure that our children are not on the street? Mr. Watley is a veteran, he's a member of ours, and he has a picture of the conditions in his home, right? And so I'm gonna tell you a little bit about the conditions that people live in, that they pay rent for in Miami-Dade County. And so as you see some of these pictures, we see ceilings collapsing. We see, if you see on the top, one of the top pictures, that's from rain coming in. You all know 2-3 weeks ago we had massive rain. A baby hurricane came out of nowhere. And so some of the folks, it floods in their homes when it rains. And these are homes that they're paying rent for, right? We see roach and rodent infestations, and we often need to name that we have a culture in Miami-Dade County where tenants are expected to pay rent on these conditions. And I'm talking about $2,000, $1,700 for a 1-bedroom apartment that looks like this, They can't breathe, their children can't focus, right? These are the conditions that people are living in. And the mold and the dampness in their places have people end up in the hospitals, right? We won't talk about people who don't have access to air conditioning in the hottest summer that we've had, record heat, right? These are the conditions that Miami folks are living in. And then lastly, I just think I have one more slide. We think about that when we say evictions are violent, we think about families who we've seen who come into the Miami Worker Center, that you see the impact that trying to look for a home, not having first, last, and security, and right now that means at least $8,000, first, last, and security, right? If you don't have that, the toll that it has on people's psyche, that we've literally seen people lose it, right? Because they don't know how they're going to get by for them and their children's, right? And so again, lots of stats on here, but suicide mortality, hospitalizations, we know and we've seen what happens to people when they can't find some place to live. I want to say that we wouldn't be community organizers if we didn't talk about what we've won. Tenants in Miami-Dade County who are experiencing conditions issues, who have experienced evictions, won a lot in the last 2 years. They wanted there to be an Office of Housing Advocacy in the Miami-Dade County, and they fought for that to happen, for funding to support that office, to increase notice periods, to have a tenant bill of rights. That was preempted this year. Well, that's a different topic. And there's so much more that we should fight for, and that we should come together through multi-sector partnerships, government, private. We don't want to see tenants by themselves advocating for more solutions. We want to see this entire room to make sure that we have the solutions we have. I know Raina gave me the 2 hour, I'm gonna pause here, the 2 minute, I'm gonna pause here. The fight continues to ensure that we know that tenants in Miami-Dade County don't belong in the streets, that children don't belong in the streets, that housing is a human right, and we believe the biggest and boldest ideas can come from Miami-Dade County.
Thank you, Sandra. So we're going to do a quick round robin here of questions, and I want to start with you, Annie. Miami Homes for All has been identifying a pipeline of affordable housing developments, whether for new development or rehabbing. And can you share with us some of the challenges that you see to making that pipeline a reality, and what is the potential role that non-traditional investors, such as philanthropy or healthcare, can play in solving for that?
Sure. So I think one of the things that Miami Homes for All is engaged in is identifying the pipeline of affordable housing deals that are kind of in the mix today, where there's site control and they're actively applying for subsidies and financing from public sector. And the purpose of that, we're modeling off of Enterprise Community Partners and a model that they have implemented in other communities successfully to draw down and attract capital and then deploy capital from multiple sources. So I think that some of the number one barrier that developers experience is the capital, but David is right, there's plenty of money. And I think we've seen multiple times in our community, and I know there's plenty of people who have seen this, personally in the course of the work, that we see that capital comes in the form of bonds, it comes in the form of subsidy from local CRAs, it comes in the form of philanthropy, sometimes private equity sniffs around, and we see it go away, or be squandered, or take a long time, or not be leveraged. So there's a really suboptimal, slow-moving capital flow kind of system. So I think the capital flow system has to be beefed up. There needs to be staffing. There needs to be a quarterback organization. Enterprise does this in other communities that brings together non-traditional and traditional partners, including the health sector, to invest and coordinate that investment, and also to prepare the deals to be ready to absorb that investment. And I think those are the things that we see missing here, but there's some incremental movement forward. The mayor creating the Building Blocks Fund, I think that is going to realize its potential, but has yet to do so.
Thank you, Annie. And I do have to say that thinking about BOLD, the Health Foundation took a big step. Our board adopted an impact investing strategy, which, David, you spoke about earlier in your presentation, and has allocated $5 million to support impact investment deals. And our very first impact investment was in late 2020, $1 million investment for Florida Community Loan Fund to support affordable housing. And that is something that's very bold for the foundation. And really, hopefully we can be looking at other types of investments like that. Barbara, we talk about how all of this has been showing up in the healthcare system. Can you speak to how is this changing as the executive lead, right, for population health and managed care at Jackson? What's being done differently in your care delivery transformation, if you will? And then what are some of the opportunities that you would hope that you're working towards in this particular space of housing and health?
Sure, thank you. So you're seeing us focus on partnerships and unique collaborations that we typically, wouldn't label under health relationships. Conversations very much like this. I don't know if Vicki Millette is in the audience, but working really closely with the Homeless Trust, understanding the need and where we can collaborate together to ensure alignment of goals and financial resources. Insofar as innovation and things that we can do together, I have a dream, and if Vicki's here, she can make it come true. I'd love to see in some of these affordable housing units that are coming up an iPad just embedded into the units where the Jackson Health System is just one, click away. With a telehealth capability. That's just one way that we can innovate. For our unhoused community, I would love to see wearables, a partnership around wearables. It'll allow us to track their health record and intervene on them before they become catastrophic. I have an endless list of innovations that I would love to pursue. And I'm thankful to the Health Foundation for the work and the funding that is being submitted. We have equity collaboratives going on right now around Black maternal health, an extraordinarily supportive organization, the Jackson Health System, who is willing to open up and be very transparent about our inefficiencies, our inability to make change, and welcoming these types of collaboratives to improve the health and well-being of the populations that we serve. And finally, the Health Foundation also funded a medical legal partnership that they're on site and they're able to intervene on evictions when it is impactful of our patient and their clients' long-term health. So these types of relationships and innovations are different for a traditional healthcare administrator, but very, very necessary.
Thank you, Barbara. Sandra, if you could identify a top priority or opportunity for resident engagement in helping inform some of these healthy housing partnerships and initiatives, could you speak or expand upon that?
Sure. I think the biggest connection for me for the intersection of health and housing has to be the conditions issues. We have to do something about the conditions issues that people who are paying rent in Miami-Dade County are experiencing. The housing stock is poor, quite frankly. They're not well maintained. If folks make complaints, they're retaliated against. People don't have working anything, right? From refrigerators to tubs to you name it. And I don't know about you all, but if you're, I think about folks during COVID who are spending a lot of time at home. That is not a safe place. That is not a healthy place to be. And while many of us were able to isolate and still go home and feel at peace, folks, their blood pressure are never coming down, right? They're living in those conditions. There's no way they don't have anxiety. There's no way they're not depressed. And so we have to do something about the conditions issue, code enforcement, whether or not these people should continue to be landlords if their conditions of the buildings are like this, something that we got to put our foot down in Miami about, something that we shouldn't shy away from. And I tell folks, y'all see it. You drive in these neighborhoods, you see these buildings. They're deplorable, right? None of us would live there, right? And neither should people, to Annie's point, who ensure that we have food on our tables, who watch our children, who teach them in schools. These are the folks who live in these conditions. And it is, I have no words to name how we should feel about what the conditions are that people live in. And we should all feel this way. We should feel outraged. In Creole, it's like enragé. We should feel so enraged about the conditions. And I think about my mom. My mom was a domestic worker. Many of the folks who live in and work in Miami-Dade County are not the 100,000 folks who make $100,000. It's our folks, right? It's the restaurant workers, it's the teachers, and they should, after hard days of work, they should be able to go into a safe, healthy place to live, and we should do something about it.
We agree. We're doing great on time. Do we have any questions from the audience? Oh, yeah, one over there.
Yep, a microphone. Hi, what I want to know is why doesn't code enforcement go after these slumlords?
Oh, that's a great question. I want to say that this is the biggest dance that we do at the Miami Worker Center. It's like code enforcement only doesn't have jurisdiction on the interior of the building. It's the state that has the right to talk or to condemn the interior of the building. Our code enforcement can only do something on the outside. Like every day, it's a different ping pong. And so at the Miami Worker Center, we're like, at the end of the day, should these folks be allowed to have these buildings that are in deplorable conditions, right? And we say no. I think, for us, there's a lot of folks for us to be like, is it at the county? Is it at the city? Not sure if Annie wants to add to this as well.
Well, I want to say something. What you showed here is obviously a structural problem on the outside of the building. They're holding up the second floor, the third floor, whatever floor that was, with some kind of scaffolding, not scaffolding, but supports. So that should be obvious to anybody that walks by the building.
And
I just want to say really one thing to that. The impossible situations that our tenants are in, do they want to live there or do they want to live in the streets? And so they won't complain because the thing that our organizers have to say to them is, we can let code enforcement know. The risk is they can condemn this building. Do you want us to get this building condemned? Then it's a whole, we have children, we don't know where we're gonna go. And as someone who lives in a house, I'm not gonna make that decision for their tenant, right? We're organizers, whatever they want us to move forward with, and they have condemned that building. And those residents, we don't know where they are, right? And so there's a push and pull that we always have to do. But again, we don't want folks in condemned buildings, but we also know that folks rather those conditions than living in the streets. And to me, those are not the options that folks who live in Miami-Dade County should have.
And if I can jump on that, and because I think you're doing that crazy dance like 3D chess. And I think we have to make sure that the policy framework around conditions and preservation, they call it preservation. What does that mean? We're rehabbing buildings and maintaining them as affordable. That's what we want. And one of the major policy recommendations for many in this community, but for Miami Homes for All and the Greater Miami Housing Alliance, is a major preservation agenda. But a lot of the buildings, there's a lot of work to be done there to make sure that the regulatory framework doesn't weaponize code enforcement, which does happen, against lower-income people who do not have choices. So we have to make sure that there are steady and very quickly moving flows of capital that can help to not strip wealth from landowners that would like to be cooperative and not displace people who are living in buildings that should be repaired.
I think we have time perhaps for one or two questions. Yes.
One more thing to that point. We're always holding these contradictions. I want to name that during COVID, the amount of wealth that folks gained and the little amount of maintenance that were done in buildings. There's research out about what happened during COVID and the lack of maintenance in buildings. And so I'm not talking about folks who own one additional property. We're talking about corporate landlords who have so much wealth who do not maintain their buildings. And I want to just name that so that folks don't leave here with an idea of little Sandro who doesn't have a lot, who doesn't want to maintain their buildings. Those are not the folks we're talking about. Those are folks who actually want to work with their tenants. They want to maintain their buildings. We have an issue with those folks in our community. And I have to name it, and some folks will be uncomfortable. That's okay.
Hi, all. Thank you so much for being on this panel and for sharing your expertise with us. I'm over here. I don't know if you can see me. My name is Jessie. I use he, him pronouns. I'm a team member at the Alliance for LGBTQ Youth. I want to start off by acknowledging the genocide that is occurring in Palestine. I think we are remiss to discuss health and housing and to not mention the over 1 million people who have been displaced from their homes in the past 4 weeks as we've seen this genocide unfold. I also want to offer a question to you all. You talk about how it's the people living in these conditions, people surviving unlivable conditions, who know what we need, right? We are the people that need to be asked what these solutions look like. So I'm curious what you're doing in your organizations, how you're creating spaces to engage with the community and understand what they want, what they need from policy and from nonprofit work.
Thank you so much for that thoughtful question. I can share that the Jackson Health System later this year will be launching the first ever community health worker strategy, where we intend to go out into the community and get to know our community in advance of their clinical needs. Why this is important is it allows us to get to know them at a time when they're not in crisis or in chaos. It allows us an opportunity to understand what their needs are from a different lens. We're hoping to break barriers in some of the communities that do not welcome institutional leadership and care. And finally, it allows us an opportunity to really construct a response to the need that they may have. And this is a new innovation that'll be released at the Jackson Health System.
Anyone else? Yeah, I mean, great question. And Sandra has been instrumental. I sort of want to pitch to her in case she wants to say, but Miami Homes for All with partners is engaging in a 10 development pilot program for small scale development, which does include preservation of affordable housing, particularly that's unsubsidized. And we are partnering with community organizations in the neighborhoods where we're supporting those developments to engage with residents and tenants of existing buildings. Sandra, you want to talk about that for just a minute?
Sure. So we are working with Miami Workers Center in Liberty City. We're working with Touching Miami with Love in Overtown. We're working with Little Haiti CDC in Little Haiti. And so many organizations, Alapata CDC in Alapata. Right now we're in the core of City of Miami doing work with, again, small developers to ensure that folks are not displaced through any projects. I will say for the Miami Workers Center, every week our organizers are knocking doors in specific communities. Right now we are lead on outreach for the eviction diversion program that the mayor just talked about. And so every week our canvassers are knocking on doors of people who've been filed, there was an eviction filed against them, to ensure they understand what the eviction process is, how to respond to an eviction, what the next steps are. And so there are thousands of people, hundreds of people on the eviction list every week. And every week we have canvassers knocking those doors. And they come to our offices, they're panicked, and we walk them through a process, really hold their hands for a process that could be very frustrating, overwhelming for folks. And so that's how we're getting our intel, that's how we're serving, that's how we're knowing what is important to them in the moment. And overwhelmingly, again, if it's not the high cost of rent, it's the conditions issues that people are naming as their number one issues.
Thank you so much. And we are way past our time. But I want to thank our panelists for the fruitful conversation. If you have any questions, please come up to them. We do have about a 5-minute break, and I do want to end by saying, Barbara showed one of the visuals, and it was the results of a community health needs assessment. And that is a process, right, that goes on every 3 or so years for our hospital systems. There's an opportunity for resident and community engagement and input. It is required. But one of the things that struck us a little bit was in a recent conversation with a local hospital system, housing was a top priority, but it did not make it to their community implementation plan. And the reason was we don't have the expertise, we wouldn't know how to begin to address that, and that is why partnership with housing, community development organizations, and others is so critical and important. So thank you so much.